Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for being with us. New districts for all 4 Arkansas congressmen and new income tax rates for at least some of their constituents. We'll get to that in a moment. First, coronavirus in Arkansas. Without question, there's been some encouraging news. Hopefully, they are trends. The number of Arkansans hospitalized is down. So is the number of patients requiring intensive care and the number needing ventilators just to remain alive. More of our fellow Arkansans are choosing to be vaccinated, though the percentage of us who have taken the jab is significantly below the national average. And if the case rate seems to be moderating, the aggregate number of infected continues to grow. In a state of 3 million souls, the number of COVID cases now approaches 500,000, and the death count now exceeds 7,500. So, what is the proper ratio of caution to optimism? We're joined now by Dr. Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences. Doctor, as always, thanks for coming in.
Steve, great to be here.
Give us your sense. What is that proper ratio? I mean, optimism and hope to caution.
Well, you know, it's kind of the tale of 2 pandemics at this point in time. The numbers in the state are coming down. We're seeing that at UAMS. We peaked about 6 weeks ago at close to 80 patients in the hospital with complications from COVID-19. We're now at around 35. We were running about 40 patients in our intensive care units. We're now at about 10 COVID-19 patients with complications. And for the first time in months, we don't have any patients on heart-lung bypass. So the trend is moving in the right direction, and that's great news for all of us. We're all looking for some relief, a light at the end of the tunnel. But the flip side of this remains. COVID-19 infections are higher in the United States than almost anywhere else in the world. And within the United States, Arkansas remains one of the top 5 states in terms of new COVID-19 cases per capita. So there's good news and reasons to be optimistic, but we are not even close to being out of the woods.
Is there some concern, Doctor, that speaking of the entire state here or for areas of the country, that we're nobody's declaring victory, but one gets the sense sometimes that we're almost prepared to accept a Korean-style armistice, that we're willing to accept a certain number of casualties?
I think that there is a little bit of that going on, and part of this is just, we will talk about COVID fatigue for the rest of our lives, that, we are all just tired of thinking about this and want to put it behind us. But that's where we could fall down, Steve. I think if we don't pay attention to the simple things that will continue to keep us safe, there's always the possibility of backsliding. And one thing that I'm really concerned about in our state is that the rates of vaccination are not uniform across the state. So we may find that there are parts of our state, pockets of states, especially more urban areas, where vaccination rates are high and where people are largely protected. But there will be parts of our state where because of access and other issues, we don't have high vaccination rates, and we still may have pockets with intense outbreaks, even when most of the state is feeling good about COVID-19.
Yes, sir, and I am also, if I'm reading the demographic data correctly, the disparity between white Arkansans and Arkansans of color is just a yawning gap there. It is still quite low in communities of color.
It remains a huge problem for us. And the challenges in each of these populations are not necessarily the same. Challenges in the Latinx community and reasons for hesitancy towards vaccination or simply lack of access to being able to be vaccinated is different than in African American communities. And then the Marshallese population in Northwest Arkansas is unique unto itself. We've got to think about each of these groups as how do we establish partnerships, how do we provide access, how do we provide the right information, and it's not going to be one size fits all. But if we don't close that gap, we're not going to be the fair and equitable state of Arkansas that we all believe we are.
Yeah, there also, Doctor, would seem to be a comprehension gap because out of the alphabet soup of health agencies in D.C., there continues to be news of one sort or another. Now, the okay has been given, at least I believe, for Pfizer vaccine recipients. For those over 65, are those especially at risk? Can you clear that up for us?
Right. So good news today. The approval process has gone through the alphabet soup that you described, the FDA, the CDC. And if you have received the Pfizer vaccine first and second doses, if you are over 65, or if you have other serious medical conditions like cancer, autoimmune diseases, or if you are in a high-risk occupation such as healthcare, you will now be eligible to get your third shot. And Steve, I will be rolling up my shirt sleeve tomorrow to get my third shot. It's the right thing to do. I think that begs the question, what about if I've had another one of the vaccines, or what if I don't fall in those groups? And I think just as we opened up the window for vaccination for the first shot, gradually early on, as we accommodated people coming in to get their shots, we'll probably also see that gradual opening up, moving beyond just the Pfizer vaccine, moving beyond just high-risk individuals. And I suspect that this will end up being similar to the relatively orderly process that we had when the vaccines were first getting introduced.
Now, of course, we're talking about boosters here, but is there not also a 6-month recommendation, Doctor, on the Pfizer vaccine in terms of that second dose?
Well, in terms of going to the third dose, so there should be a 6-month interval between the second dose and the third dose. So you want to make sure that time interval has passed. And then the other, maybe even bigger issue, Steve, is going to be what about 6 to 11-year-olds? And I think at this time, reading the tea leaves, is probably only going to be a matter of weeks before the vaccines, at least the Pfizer vaccine, is eligible for the 6 to 11-year-old age group. And that's going to be huge in terms of thinking about how we educate our kids safely and how we have a safe school environment.
Well, you answered the question before I could pose it, sir. Is there concern in the part of the clinical community now about yet another wave owing to autumn sports activities, congregate settings, whatever?
We can't discount that. We can't let our guard down. There is certainly always the possibility of yet another variant, especially a variant that potentially could evade some of the immune responses that are generated either by natural infection with the previous strain or with the vaccine. You're right. I encourage everybody to go out and find a restaurant that is practicing social distancing and have a nice dinner outdoors. But when the weather gets colder, we're not going to be able to do that. And are we going to be pushed into situations where it's more likely that the virus can be transmitted? My suspicion, Steve, is that we are probably in a transitional point with COVID-19, and that this will be the last winter when there are lumps and bumps, and probably the winter of 2022, COVID-19 will look more and more like a second flu.
If I could, Doctor, let's go back for just a second to the booster shot, the Pfizer booster shot, and eventually the Moderna and the J&J, I suppose. High-risk occupations. Now, you mentioned healthcare workers. Are there other fields, other disciplines, occupations that you would consider high risk?
Well, right now that hasn't been as clearly elucidated as we want it to be. It's clearly going to be healthcare workers. It's probably going to be people who live in residentially congregated areas like nursing homes, people who live or work in the prison system. That may eventually open up to people who are working in poultry plants and places where you have to work side by side with other people and can't avoid that. So, there's going to be more education and more to come in terms of really clearly defining that. Frankly, I think that we should draw that boundary as broadly as we possibly can.
Well, we're entering into conventional flu season, if there is such a thing any longer, Doctor, as conventional flu. What about, do you recommend a flu shot for those who have already had the coronavirus shot? Can the booster and the flu shot be taken together simultaneously?
Yeah, so those are great questions. You know, we had almost no influenza last year, and we're expecting that we'll have a rebound season this year, kind of a catch-up. We saw that in kids this year with RSV. Last year, almost no RSV. This year, RSV really came out of the woodwork and impacted Children's Hospital and other places. So, we can't let our guard down against influenza either. The good news is that there's no reason why you can't get your flu shot at the exact same time that you're getting a booster shot or your first COVID-19 vaccine shot if you haven't gotten one yet. There's no cross-reactivity. There's no change or increase in the incidence of side effects. So, if it's easier for you to do that, get both of your shots at the same time. But, the most important thing, Steve, is get your shots, both your COVID-19 shots, whether it's a booster or your first shot, and go ahead and get your flu shot this year, because whether it's influenza or COVID-19, if you're knocked up and in the hospital, you're not doing well.
All right, message delivered. Dr. Cam Patterson at UAMS, as always, thanks very much for coming in. Come back soon.
Will do.
And we'll be right back. And we are back, and so is the General Assembly, or at least it will be next week. And you thought it was done for the year. No. Back from recess to tackle the question of congressional districts. They have to be redrawn every 10 years. And while the census of 2020 confirmed much of what observers already knew in terms of population shift, still a chore. So how big a chore? We're joined by Speaker Matthew Shepard, Republican of El Dorado. Mr. Speaker, at the Capitol, thank you very much for your time. Thank you for being with us.
Thank you. Always good to be with you, Steve.
Well, we need to inform the audience because of your schedule and ours. We're having to tape this portion of the broadcast on Wednesday afternoon. Already there are, as of this moment, mid-afternoon, 8 proposals for reapportionment?
That's what I've been told. Just right before we sat down here, the latest numbers were 8 proposals. I believe that there were 4 that were filed to this point today. So, I anticipate there'll be other proposals filed as we move towards reconvening next week.
Lots of fun for everybody. Well, I'll tell you what, we have 3, really the first 3, Mr. Speaker, and for illustrative purposes, kind of give the audience a better idea of what we're talking about in terms of the census and shifting those boundary lines. Let's take a look at the first 3. The first one is from Representative Speaks. Nelda Speaks, she proposed this from her Mountain Home District, and hers would move, Pope and Van Buren to the 4th. Currently, Van Buren's is in the Central Arkansas District, the 2nd District. Pope's in the 3rd. It would take a portion of Jefferson and move it from the 4th up to over to the 1st District. Boone and Marion would go to the 1st District as well from the 3rd District where they currently are. Then there's 1960, House Bill 1960, pre-filed by the gentleman from Jonesboro, Mr. Ladyman. Pope and a portion of Jefferson would go to the 4th. Marion and Newton would be moved to the 1st. More of the Ozarks into the 1st, along with the northern part of White County, dividing a county. And Ladyman would, he says, amend his bill to have all of Searcy County, that Marshall area, into the 1st. 1961, House Bill 1961. A Democratic proposal, David Whitaker of Fayetteville, would move Arkansas, Lincoln, Deshay, and Pope to the 4th District. This caused a little controversy from some of the farm members and some of the farm establishment in southeast Arkansas. Mr. Whitaker says, in effect, oops, I'll take it back to the drawing board. Anyway, Mr. Speaker, that's kind of kind of the math and kind of the configurations that any reapportionment has to take into consideration. Are we ready?
Well, we're certainly ready to reconvene. The question really gets into is, is there a consensus yet? And I don't think we're at a point in time where, as we sit here today, I don't know what those maps will ultimately look like. I think that's one of the reasons we're having 2 state agencies meetings this week and another, I believe, set for next week. And then obviously when we reconvene, we'll have additional meetings where the bills will actually be considered, because we do want public input. We want to have hear the public's viewpoint on this, let them have their say, and then clearly every one of the members has that opportunity to file a bill if they have an idea or some thought as to how those districts should be drawn. They have the opportunity to file that bill. We tried to once we got the numbers and understanding that we need to do our work as soon as possible, just because there is it's important, I think, for the public and others to know what those district lines look like as we head into the midterm elections next year. But when we finally received the numbers from the Census Bureau, which was delayed by a number of months, when we finally got those numbers, myself and Senator Hickey, and along with the state agencies chairs, have tried to lay out a path forward towards reconvening and make sure the public is aware of what that process looks like. Yeah,
and of course, Mr. Hickey, of whom you speak, is your Senate counterpart, the pro tem in the Senate. Looking at the political temperature of the state, sir, from Miller to Clay and Benton down to Chico, shifting any of these lines to any degree is unlikely to change the partisan composition or the ideological composition of the congressional delegation, or would you disagree?
I really couldn't. I don't know that I could sit here and say one way or the other. I mean, anecdotally and from what I've seen, it seems that Arkansas is a solidly Republican state. But I don't know. I haven't tried to, study what that would look like. And there's so many different proposals being talked about, so many things that have been filed. But unquestionably, when you look back at how Arkansas has voted, particularly over the last 10 years, it does seem to be a solidly Republican state.
Well, I cannot at this junction. Of course, next year's balloting is next year. But can you look at do you see any of the 4 being significantly endangered by either current events or a redistricting, a reapportionment?
I would sit here and say that the primary focus that I have at this point in time is trying to have maps that are true to the what's required by law. And we understand that we're in an environment where everything we do is going to be under the microscope. And so we want to put forth maps that, or at least myself as a position of leadership, I want to, hopefully we have maps that are defensible and that all Arkansans can feel good about the process that we went through. I mean, you've got to remember that 10 years ago was the advent of the Fayetteville finger that was out there and considered for a period of time. And certainly for someone from South Arkansas in the 4th District, and with the prospects of having those lines drawn into downtown Fayetteville, I wasn't pleased with where we were at there. Fortunately, that didn't come to pass. But it's just, that's something that is a reminder to me, and I think many others, that the process is important, how we conduct our business is important, and ultimately we know that the outcome of that process is very important to the people of Arkansas.
Well, in terms of Washington representation, right now you're only dealing with 4 districts. You will soon have to deal at a state level with 135 districts. The headaches grow exponentially, to put it mildly.
Well, that's something that the Attorney General, the Secretary of State, and the Governor will get to take up. And I know that they're taking public input just the same as we are, just as we do with the congressional redistricting. They have the same task in front of them as to legislative redistricting. I know that they've had a number of meetings around the state hearing from the public, and undoubtedly they're hearing from a lot of representatives and senators and other interested parties as to what those maps should look like. And I think that ultimately what we see when it comes to legislative redistricting is just the loss of population in South and East Arkansas. That's going to present the particular challenges where Northwest Arkansas has grown, Central Arkansas has grown to some extent, and so it does become more challenging. As I said off air, it's much easier to draw 4 districts than to have to draw 100 or 35 on the Senate end. And, I know the governor, the attorney general, and the secretary of state, they have a lot of work in front of them.
Are we about to look at some fratricide here? It's unavoidable, it would seem, given the population shifts. You're going to have members running against members should everybody seek re-election.
There certainly is that possibility. I mean, when you look to South and East Arkansas and you see that there are going to be there has to be a number of districts that are going to have to move, and that Northwest Arkansas in particular is going to gain a number of districts, it definitely creates some challenges. Any year, any cycle, there's going to be members that decide to run for other seats or not run at all. So there could be there's going to be there could be some of that, but to your point, there is always that possibility that we on the House end, and by the same token on the Senate end, that there could be unavoidable situations where members could potentially face each other should they both decide to run.
Both chambers. If we could, Mr. Speaker, I'd like to shift to taxes for a moment. Mr. Hutchinson, the governor has said that he's not prepared to pull the trigger on a special session yet on taxes because he sees no consensus. Do you see one evolving at all on your side of the Capitol?
I think so. I think that we're very close to having some consensus on that issue. I think that, it's been reported, and myself, Representative Jett, and then leadership on the Senate end as well has been quoted in the press as to what we kind of see as the parameters of that. What I believe is right now that we're working towards a reduction of the top rate to 5.5% and smoothing of the so-called cliffs, which likely involves combining 2 of the 3 tables. And then hopefully we can also have a path to 4.9% that will be laid out over the next 3 years. And I think that's something that by and large the House and Senate can be supportive of. I know that leadership on both ends has been talking with members, has been sharing what those ideas, and that the response has been very supportive. And much of that is, I think, because of the fact that these ideas, these parameters, and what's being put forth is really in response to what we're hearing from the members. And, we've been in contact with the governor. I anticipate that myself and Senator Hickey and the governor will sit down in the real near future, next several days or weeks, to hopefully we can all be on the same page. There could be, right now, I think the biggest issue that may still be lingering is just some of the discussion of how to smooth out those cliffs. DFNA had put out some proposals early on. Senator Dismay has taken the lead on some things. This has been an issue that he's really worked on for a number of years. And so, there's still some stuff to be hammered out. But I really believe at the end of the day, we'll be on the same page, and the governor will be able to call a special session. And, hopefully as to that issue, we can know we have strong support and can take care of implementing further tax relief for the people of Arkansas.
Well, some would argue, Mr. Speaker, opponent, there is some opposition to the tax cuts who argue that they are possible, certainly philosophically or politically, but they are not necessarily prudent in budgetary terms, in terms of the state's needs. Your response?
Well, I think that what you've seen over the last number of years is that we've been able to cut taxes at a fairly sizable clip, and we've been able to build up a long-term reserve fund I think serves the state well. It's something that I think most experts have advised that the state needs to have some type of long-term reserve fund. We've been able to do that, and we've been able to meet the needs at the state level throughout this. And so I think that we've, through responsible conservative budgeting and tax policy, I think that we've demonstrated over the last number of years that this can be done. And I think it's something that the membership and I think the people of Arkansas are really looking for. And I think that what we'll see is that hopefully, at the end of the day, when we find consensus on these proposals, is that you're going to see tax cuts that provide relief throughout the spectrum of taxpayers, and that particularly with regard to the middle income taxpayers, that they're going to see relief. And that's something that I think is important. I think that as you look back at what we've done over the last number of years, we've been able to provide a lot of tax relief at different income levels. And so I think this is another step in the right direction.
Got to end it there, Mr. Speaker, because we're simply out of time. We thank you for yours. Come back soon.
Thank you, Steve.
And as always, we thank you for watching. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.